don't get distracted with things that people are saying that seem rather convenient or don't seem true or not backed by science.
President Trump saying the use of acetaminophen, the main ingredient in Tylenol during pregnancy, could be linked to a higher risk of autism. Good evening. I'm Karen Edwards.
I'm Matt Malloy. The President and Health Secretary Robert F. Kennedy Jr. recommending that pregnant women limit using that drug. As 13 WHAM Stephen Pappas explains, many health officials say the announcement comes with no scientific backing. Stephen?
Yeah, Matt and Karen, the Ontario County Health Director says what causes autism is not as simple as whether you take a certain medication while pregnant. Local health experts are pushing back after a controversial announcement by President Trump and Health Secretary RFK Jr. on Monday.
So taking Tylenol is not good. All right, I'll say it. It's not good. You know, the way I look at it, don't take it. Don't take it. There's no downside in not taking it. So ideally, you don't take it at all, but if you can't tough it out, or if there's a problem, you're going to end up doing it.
To think that autism is caused by one thing is really naive, and it's just wrong. Autism is a complex disease.
The president says the FDA will start notifying physicians immediately to stop recommending the drug acetaminophen to pregnant women unless in the case of high fever and would pose a risk to the fetus, linking it to an increased risk of autism.
I think people think that pregnant women are just like popping Tylenol 3 times a day. That would be very rare. I worked in OB/GYN for 14 years, and women tried so hard not to take medications during pregnancy. They would agonize over every Tylenol, every Sudafed, or whatever else they needed to take for whatever symptom they were having.
Leading medical groups say there have been dozens of large studies over the decades, none of which found acetaminophen to cause autism. Ontario County Director of Public Health Kate Ott says the press conference and its alleged findings are concerning.
We used to be able to trust the CDC, the ACIP, the FDA, and Health and Human Services. They have been the gold standard for my whole career in public health. We can no longer trust them explicitly.
The Monroe County Department of Public Health also releasing a statement refuting the president's remarks, referencing a 2024 study of nearly 2.5 million people that does not support a causal link between acetaminophen use during pregnancy and autism. Ott says she trusts Tylenol for pregnant women.
If I had a pregnant person in my life, I would have no qualms about them taking it. In some instances, it's more dangerous not to take medication. So an early pregnant person, particularly with a fever, needs to treat that fever.
The Department of Health says it will launch a nationwide public service campaign to inform families and protect public health. It will also initiate the process to change those safety labels on the drug. The company that makes Tylenol saying today that it strongly disagrees with the White House's claims. Matt, back to you.